Hello everyone, this is Rainy and Sophiana, and today we're gonna introduce exoskeletons.
Exoskeletons are wearable technology that helps paraplegics walk by providing support to the torso and legs. Exoskeletons are typically used by individuals with a T3 level of spinal cord injury or below, because T3 level injuries and below do not damage sensation or movement in the arms or hands. This is crucial because users have to rely on crutches for balance while wearing an exoskeleton. There are two main functions of exoskeletons. With the technology currently available, most exoskeletons are only used at this point for rehabilitation purposes during sessions with a trained professional. These exoskeletons are not meant for everyday independent use and rely on a professional therapist to help the user with balance and to spot the user. Exoskeletons for rehabilitation purposes, such as the Atalante, made by Wandercraft, are mostly used for gait training types of rehabilitation therapy. Other exoskeletons are meant for everyday use, for someone who is paraplegic to independently walk and move around in. These exoskeletons, for the most part, are still in development and are early prototypes of what will become an everyday assistive device for paraplegics in the future. The Rewalk Personal 6.0 exoskeleton is one of these everyday exoskeletons, designed to be used all day and in multiple different environments. Exoskeletons can be a cool way to get paraplegics with limited motor control back on their feet again. If the spinal cord injury is very severe, there might not be a possibility of walking again, but the exoskeleton is one way that it is possible. Exoskeletons are great because they do not require any surgical intervention or even a simple medical procedure. Using an exoskeleton allows individuals with spinal cord injuries to be more active and move parts of their bodies that they otherwise wouldn't be able to, which improves circulation and blood flow. Using an exoskeleton can also reduce muscular atrophy. When people become paralyzed, their muscles will shrink since they're not moving around as much in order to conserve energy. Using an exoskeleton can help people maintain more of their muscle and bone density by helping them move around and bear weight. One of the biggest barriers preventing people with paraplegia from getting an exoskeleton is how expensive it is. These devices start at a minimum of $40,000 and can get way more expensive. $40,000 is actually the cheapest exoskeleton currently available. Additionally, individuals must learn how to properly use the exoskeleton, meaning they will have to hire and work with a trained clinician, adding even more costs. Usually, individuals require an average of 10 to 15 sessions to learn how to walk independently with an exoskeleton. Some insurance companies might pay for individuals with paraplegia to get an exoskeleton, but it's not very common. Not just anyone is eligible to use an exoskeleton. There are specific strength, height, and weight requirements that exclude many people from using one. For example, in order to use the Rewalk, spinal cord injury patients must have quote-unquote normal upper extremity functions to use crutches, be between 5 feet and 3 inches and 6 feet and 2 inches, weigh less than 220 pounds, and have a healthy enough bone density that they can bear their own weight on their legs. Another potential problem is that people using exoskeletons can become too dependent on the exoskeleton for mobility. Traditional rehab from spinal cord injuries relies on the concept of neuroplasticity, which is the spinal cord's ability to make adaptive changes and to rewire itself. Neuroplasticity relies on the use of the weakened muscles to stimulate the process. Unlike what happens in other rehab therapy techniques, exoskeleton users may get used to just leaning forward and letting the exoskeleton do the work. Rather than actively trying to practice walking motions, users might become dependent on the exoskeleton for their mobility. Because of this, people who have the potential to regain walking functions might not actually regain their walking function. This means that exoskeletons may be a better option for individuals with complete spinal cord injuries, because it is unlikely that they will be able to regain any function in their legs.
In looking deeper into the world of exoskeletons, we have noticed two trends that might indicate the future development of it. Emerging technologies like robotics, artificial intelligence, and smart fabric make it possible that a device can be both multifunctional and powered by smarter algorithms. Beyond that, we also expect the design to be more inclusive and accessible, both in terms of a wider user group and easier access to get one. There are two design trends we identified. One is invisible, as can be seen in wearable assistive devices like power clothing, which functions like exoskeletons without being seen. Another is universal, a universal user group. This means that people who don't necessarily have mobility difficulties can also use products with similar structures and mechanisms as exoskeletons to make their life easier. The principle of invisible can be seen in power clothing or power assist functional clothing, which is used to support muscle function for the elderly and people with neuromuscular diseases. We found two examples of this type of product particularly inspiring. This Red Dot award-winning device is designed for disabled individuals who suffer from neuromuscular diseases and also who will need external power-assistive devices to ensure a better quality of independent living. This device also helps with the daily upper body movements and assists with rehabilitation training. With the help of a flexible transmission system in the power layer, the users can easily perform bilateral elbow flexion and extension movements. The wear layer is connected to the power layer via zippers. The airbags will also make the movements smoother and safer for the user. Compared to exoskeletons on the market, this product is lighter, smarter, and more multifunctional. It will be almost invisible if wearing it inside and covered with clothes. With more mobility support functions, users can live more actively and confidently. However, it is also expensive. There is still a long way to go to make this amazing device accessible to more people. Another good example is the Responsive Garments by Yves Bihar's Studio Fuse project. Electric muscles assist people with disabilities in walking, standing up, and climbing stairs. What's unique about this device is the use of artificial intelligence and the special design of the pods, or the electric muscles. The pods are located on the torso, hips, legs, and back, and are embedded with sensors. Each uses artificial intelligence to react to the body's natural movements and add muscle power to aid the wearer in getting up, sitting down, or staying upright. The clothing, which is made from a lightweight and flexible fabric, aims to provide the user with a higher level of strength through a series of motors housed in hexagonal pods. Although the concept was developed 5 years ago, the technology implemented in this project still seems very neat. This prototype is expected to cover a large group of audience, including people with multiple mobility disabilities and athletes. Both cases demonstrate the mission of empowering users to live independently, actively, and confidently. This invisible design principle is also important because they are targeting the aged population. Instead of reinforcing the clinical look and sick room aesthetic, those designs are all about comfort, performance, and even style. Assistive technology can become their new fashion. Another future trend we identified is universal user. Originally designed for people with disabilities, the concept of exoskeleton is used in other product design process and can benefit more people. Just like a screen reader, which is originally designed for people with vision disabilities, can later become popular among many other users. With similar supporting mechanism of body weight, these wearable chairs are designed for workspace and help people who sit for a long time to smoothly switch from standing, sitting, and moving. From what we have covered so far, we look forward to seeing a cheaper, lighter, and easier device. This will definitely require the industry to innovate a more efficient production flow for mass production. We are also curious about how exoskeleton can be implemented in other scenarios, for example, sports, wheelchair, and animals. Hopefully, we can know these answers soon. Thank you so much for watching. If you have any questions, please don't hesitate to email us.